Hello and welcome back for episode 24 of the NoobieDentist Podcast. I'm your host, Dr. Omid Azami. I took a few weeks off to enjoy my break a little bit. Since moving down to Australia, I had to wait for my paperwork to come in, and then I had to go through the process of, finding an associateship position and finding the right one, which I wanted to be really picky about and make sure I sort of landed myself into a good situation where I can have some mentorship, where I can be busy. So I do plan on making a little video about the job hunt, giving some advice from my experiences. I have had a fair few associate positions in my early part of my career. So I'll definitely want to share some of that experiences with new grads and tell them sort of what things to look for and what to try and avoid. I do hope to release a bunch of episodes. I have recorded a fair few, and I will try to get one out per week over the next little bit. Starting work finally next week, so I'm excited about that to get going again and starting to do some dentistry. In this episode, I talked to Dr. Sully Sullivan, who is one of the hosts of the Millennial Dentist Podcast. He is a fantastic guy. He's become a great mentor of mine. And in this episode, we actually talk about a lot of stuff, and he just drops a lot of knowledge. He's definitely a young dentist that I look up to and try and aspire to. Him and Dr. Payman, Dr. Payre on Instagram, are partnering up and doing a lot of great things with the Millennial Dentist Podcast. So if you do listen to my podcast, I hope you do check out their podcast because they do have a great content. They do have a great product, and I'm sure you'll get a lot of great value from it. I certainly listen to it every week, so I'm sure you guys will enjoy it as well. So I'll jump into the episode. Please enjoy. The podcast is available now on YouTube, on Spotify, on Apple Music, onto the podcast app, or any other podcasting app that you may have. I'm just trying to make it as easy and accessible for everyone as possible. I hope you guys enjoy the podcast. Stay tuned. There is a lot of great episodes coming up, and with a lot of fantastic speakers that you'll know really well, especially if you're active on the Instagram community. So without further ado, we'll jump in and enjoy the episode.
Hello, and welcome to the NoobieDentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The NoobieDentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
So I'm here with Dr. Sully Sullivan out of Nashville, and the host of the Millennial Dentist Podcast. I've been wanting to talk to him for a long time. I'm a big fan of his, and he's one of the main reasons actually in his podcast that I got into podcasting in the first place. I actually remember I was at the gym and I was listening to the Howard Frame podcast, and you came on, and just like the way you talk and how enthusiastic you speak and everything is really motivating. And I was like, man, I really need to get my own podcast going and start that up. So I'm really happy to be here with you. I'm excited to kind of dive into a few topics. And so how I like to do things, and I think I may have copied this from you guys actually, is we'll dive into your origin story and we'll kind of kick things off from there.
Heck yeah, man. Well, dude, thank you so much for allowing me to come on. And likewise, dude, I think it's really an inspiration to everybody. That Howard Frame episode was definitely, that was a wild one too, because that was a classic, old guy trying to talk crap about the way we all do things. Like, not how we all do things. Like, we're not all living in our parents' basements. Like, get out of here. But yeah, that was a fun one. Which, yeah, man. So I graduated in May of 2015.
Yeah.
I was kind of a unique story, I guess. Or I was not that unique in that I had a family that had been in dentistry for a while. So, you have ones that have been really in dentistry and not been in dentistry, and was very fortunate to have that. So
yeah,
when I graduated, I kind of knew early on that I was going to go in with my dad. And you never know how that's going to work. I mean, I have a lot of classmates who have done that now, and it's kind of like not necessarily been the biggest win. So you just kind of never know. And so thankfully, very early on, we knew that this was going to be successful. And part of that, I think, was, if I look back and see, because really the reality is our success has not been necessarily father and son, but just really good on the associate end and really good on the employer end.
Yeah.
Because early on, Dad had a plan, or we didn't really have a plan, but we kind of came up with a plan on the fly.
Yeah.
But really, that was ultimately to figure out, okay, how can we promote you and get you busy without me taking a hit?
Mm-hmm.
Because I think what happens in a lot of associateships is the young dentist will come into the associateship because the older dentist thinks they're either ready to cut back or because they don't want to do the
fillings and
dentistry.
stuff. Yeah.
Yeah, exactly. So then it's like this false mentality of, well, you're going to come in and do all my bitch work. And that's not really appealing. So then we have problems, right? We have and so what Dad did for me was, well, and he kind of encouraged this. My senior year of dental school, in like May, I went and took 6 month smiles level 1.
Nice.
So before I graduated, I went out and learned how to do that because Dad was doing no ortho in his practice.
Okay, so he saw an area that you could have just jumped right away and just took on patients right off. Just go.
Exactly, because he's like, look, we have an established practice. We have patients that want to do this. We don't want to. They'd like to do ortho, but they don't want to leave the practice. That I think that there's an area of need here. And so I was like, okay, and then the real, let's be real here. When you graduate dental school, you really have no idea what you really want to do. I mean, you had some experience in things, but not a ton of experience. Okay. So I came in and then right away started doing ortho, and it was crazy because what would happen is sure enough, and it really blew my dad away. He kind of thought it would happen, but he was blown away by the amount of patients where he had told them, hey, you should go get braces. You should go get braces. You should go get braces. They hadn't done it for years. And as soon as we give it as an option in our practice, they're willing to do it. Yeah. Because they know they know where to park. They know they know all that. So they like that. We made it easy on them, and we were probably more affordable, obviously. Mm-hmm. So I do that, come to the practice, and then we kind of keep that train going as far as trying to find areas where we could kind of get tighter. I went and took Chow's pinhole graft back in, I guess that fall, like October. Yeah. People always ask well, how did you pay for that? I took out a daggum lending club. I was like a patient, I mean, at the end of the day, I was like, look, if this course costs $5,000 and I can charge a patient $3,000 for an arch, and that means in 2 patients, I basically paid the course back. Yeah. So I was like, okay, so let's go for it. Let's do it. So just borrow the money and go do it. So that was kind of the mentality, because then Dad wasn't doing any soft tissue grafting. Now we have an opportunity to do that. So I go and do that, and then kind of the same thing happened with.
So my question is, though, obviously these patients have all been primed and they're ready to go. You kind of walk in there, they know they need ortho. They're not new patients to the practice or existing patients. So what advice do you have for a new grad who is an associate in a practice, and they're just seeing the new patients in the practice, right? They're not taking over existing work, or they're not being funneled specific types of cases. To you go and take a 10 grand implant course or a $5,000 pinhole surgery course, not knowing that when they come back to the practice, that caseload will be there right away to get that practice and get your hands wet and go. How would you? I know obviously you weren't in that situation, but how would you think you would have approached it that way?
Well, but part of it I was, though. So let's take, so the reality is that in every single practice, there are people who have crooked teeth. There are people who are, need soft tissue grafting, and there are people who are missing teeth who want implants. Yeah. Okay. So in my practice, my employer, let's just not even call him Dad. Okay. Yeah. We're not doing any of those things. Mm-hmm. So what are we doing with those patients right now? We're referring them out. Yeah. Or we're not even offering it as a service. Mm-hmm. So problem becomes is, and what annoys me a lot of times is I'll talk to young dentists or new graduates, and they'll be like, well, I go into this practice and the doctor's not giving me anything. Yeah. Well, first off, okay, well, there's 2 problems with that, right? One, the doctor should want to help funnel things to you because your success
makes the practice money. Yeah.
Right. Makes the practice money, is his retirement plan. There's a lot of reasons why the older dentist or senior dentist should be helping you get crowns, fillings, root canals, whatever it is. If a patient's willing to let you do it, they should let you do it. Yeah. Now, besides that, though, what I see too many times is that they'll sit there and wait on their butt. Okay. And they'll be like, well, I don't have any crowns to do. There's no patients, or he's doing them, or whatever. And so then I'll say, well, okay, well, let's take implants, for example, right? Because all young dentists want to play.
Everyone wants implants. Yeah.
Implants, which implants rock. So implants is a great example. If your senior dentist doesn't place implants, okay, and you're sitting there on your butt, not busy, why aren't you going to pay $10,000 to place implants? Yeah. I'm asking the question. You answer the question.
Okay. I want to answer it now. I want to come back with a question first though. For the average dentist, and one of the reasons I started like my podcast was I wanted to be like the voice of like the average dentist, because you guys are, I mean, I look on Instagram, I listen to you guys and like Life of Dentistry and all these dentists are just like rock stars, right? It's like, I'm like, you're coming out of school, you're like doing like 4 like Paymon. I'm like, how are you like 2 years out and you're like doing like oral surgery level like implant work, right? So I'm like sitting in my office, like I'm a new grad, I'm like struggling to do like a MOD, like have like an open contact. I'm like, and I'm looking across the border and I see you guys like placing implants. I'm like, how are they like confident enough? How do they have the skills to do that, right? And so that's what like my question to you is, like, were you comfortable like doing a molar endo before you did implants, or you kind of just like skipped over that step?
Oh, boy, that's a great question. Actually, that's a phenomenal question. Well, part of it is because one, look, we're not that good. Okay, Paymon's pretty better than I am, but like the reality is like, look, a little bit of it is fake it till you make it.
Yeah.
And the second thing, I guarantee you, there are very few people our age that have taken more continuing education than he and I have.
Yeah.
And so the biggest thing is we have kept running, kept spending money, and kept trying to educate ourselves. So it's not like, so like, let's take endo, for example. I was not that, I did like 3 root canals in dental school. Wasn't that good?
Yeah.
I'm still not, that's probably why I don't do as much, or you don't see me posting endo cases because like, it's just, maybe I'm not as good at that. Right. But I still, would read message boards after message boards on what endo system to use and how to get better at endo, how to work down, calcified canals. It really was just like, I'm going to go learn and figure it out. And then for me personally, I realized, wow, I like surgery. I like the implants. So that was where I really started spending money on and doing more education. So I think at the end of the day, it comes back to just taking the time to learn and doing more education. Because I mean, look, I hate fillings, and part of the reason I hate fillings is probably because I'm not that good at fillings. I'm right there with you. Like, I struggle to get contact when I'm doing like MOD.
Yeah.
That's just a hard part of dentistry. So I think part of it is Instagram is misleading sometimes, just because I respect the crap out of people who post these phenomenal MODs.
Yeah,
honestly,
it's one of the hardest things to do in dentistry, I think.
Dude, I swear, my big problem with like letting doing the expanded function and like is because I am right there with you, man. I think an MOD filling on like number 3 is one of the hardest things we do in dentistry.
Yeah,
I totally agree. And so yeah, I think that it's not. First off, don't feel bad if you're listening and you suck at those things, because the reality is I think that's really hard. And 2, I'm probably a little bit of a culprit of why am I not taking more CE on MODs?
Yeah.
Like, I think that's a big thing. It's like, I actually had that conversation with my dad today. I said, we're doing all these removable dentures and more fixed stuff, and we're trying to do more implant prosthetic stuff. And I said, we really need to go back to learn how to make a denture.
Yeah.
I was like, you and I both need a really good CE on just removable dentures, because if you can't build a good denture right, then you can't, go
to the next step. Yeah.
Exactly. So it's like, okay, we're really good at making the implant stick now, but like so part of it is it's the fake it till you make it.
Yeah.
I think part of it is you just, I am so honest with patients when I'm learning to do things. I'll just be like, hey, I've never done this before.
Yeah. You say that to them?
Oh yeah. You crack up. You'd be like,
I think that's the best way to do it though. If you can't do it that way, then you set the bar low. And then
because look, I mean, how many times a day do you have a patient that says they can't afford something? Like
very frequently.
And so the reality is exactly. So there's tons of opportunities to do dentistry. It just sometimes, and so, and obviously if you're an associate, maybe your older doctor's not cool with that, but frankly, then he's probably a crappy older doctor and you can find something else to work for. But, at some point there are times where it's like endo, that's a great one early on when you're talking, because the number one thing that most young dentists and associates have right now is time.
Yeah, absolutely.
Time. They're not booked out. So when a patient walks in with number 3, that has 4 canals, it may take me 3. I mean, I remember at one point, this is hilarious, and this patient's still a patient. I don't know why she is. But when we got done, we both high fives. Like, she was she was excited to be done. And I was like, we did it. Look how good it looked.
Yeah.
It's like, and I was like, and it was one of those patients where, she probably just would have had the tooth extracted because she didn't want to pay for the endo.
Yeah.
So like the next time that a patient walks in that where like, they're like, well, I'll just pull it. It was like, hey, well, I'd love to actually do it. Can I just do it for the price of whatever it would cost to take it out?
Yeah.
You get nothing to lose.
Yeah, that's so smart. I think that's the best way. And I've had that talk with a lot of people, and we say, it was actually one of my like earlier guests that I had on, and we were talking about if it's something that you want to try and you want to do it a bit more, and finances and like the stress of like, what if it fails is like a thing that's on your mind. That's the best way. Like if a tooth is going to be extracted, be like, listen, let me do some like crown lengthening. Let me do some endo on this. I'll charge you like a nominal fee. And if it fails, it's going to go anyways, then we'll take it out. And then you have no stress. The patient's not going to come at you and be like, your work failed and try and come after you like that way. I think that's the best approach.
On that point, we live in such a world of like, and we're so terrified when we graduate about liability and like, look, all that stuff's really important. Like it's important and whatnot. But at the end of the day, like most patients, I don't think are like looking to sue you. Right.
Yeah.
And if you're honest and tell the truth and like treat patients right. I mean, I don't know if you heard the story about my dad, but my dad, when he was like second year out of dental school, my dad he was supposed to do endo on 23 and 24.
Yeah.
He did the endo on 25 and 26. So when he took the post-op PA, he realized, oh my gosh, I did the endo on the wrong two teeth. And
yeah.
So what he did, it's a crazy story. The patient, she's still a patient today, like 30 years later.
Yeah.
He leaned her up in the chair and said, you have three options. I can lean you back down and you're going to get 4 root canals for free today.
Yeah.
I can, send you to a specialist and you won't pay a dime and they'll do their 2 root canals, or you can do whatever you want. And the patient looked him in the eye and said, lean me back down. And like, and then years later, he went back and asked the lady, he's like, why are you still here? Because you can imagine every time that had like an exam check, it would like give him the heebie-jeebies.
Yeah.
And she tells him, she goes, you were honest, like you told me the truth. Like stuff happened. So anyway, I kind of like to think the best of people. And that's how I did my first sinus lift. I was like, I've never done this before, but I've watched a couple YouTube videos.
You told the patient that?
I didn't tell the patient that. I was confident doing it, and I'd seen some people and like, but I was basically like, I've never done one. I think I can handle it. Yeah. But I want you to know that here are the complications. Here's what can go wrong, and and he couldn't. I did it for free.
Yeah. Yeah, if you do it for free, I think that goes a long way. That's awesome. So I mean, the one good thing that you have, and that's like a pretty cool situation, is obviously you had your dad there, right? So even if you're doing something and you kind of get stuck a little bit, someone's there to bail you out a little bit or have that advice. You can like kind of walk out the room and be like, what can I do? This happened. What do I say? What do I do? I don't know what it is over there, like, but in Toronto here right now, obviously like corporate's like a big thing. I know it's the same in the US. And even like non-corporate, there's a lot of like dentists that kind of own like 3 or 4 practices and like satellite offices. And so a lot of new grads, like including myself, like pretty much from day one, I've been by myself, like in a practice. So it's a little bit scarier, like to like push your boundaries when there's no one there, because if something goes wrong, 100%. And then what are you going to do? Right. You kind of have like, there's no safety net. So what's your advice for someone in that situation? How to safely kind of start, pushing their boundaries a little bit, start taking on a bit more procedures, and kind of trying to grow their practice that way.
So give me like an example of like in your practice over the last couple of weeks where you were like maybe hesitant to do something.
Oral surgery stuff has been pretty good. I mean, in school, like I wanted to be an oral surgeon, so I did a lot of oral surgery in school. So that side has been okay. I'll give you a good endo story. So it was my first probably like month of practicing, and I wasn't super busy. I was in the city, and it's a practice that I left like after like 7 or 8 weeks. And I was there as a new, obviously I was new to the practice, and the system was new system, and everything was pretty new. I do the endo, and I know it's not going well. Like I haven't like done anything bad, but like it's not going well either. And so I access, I find the canals, I obturate, I take the final PA, and it's like 3-4 mils short, like on the distal. And that's like that zone of like shit. What do I do? Like, do I tell, like, I tell the patient, like, do I say like, do we do it again, or I send you off, or like, so in that situation, I sat him up and I was like, listen, like this, I did my best, but it's not the best it could be. I think it can be done better. So like, I won't charge you, and we can send you to a specialist and they can like do it better for you. if that's what you want. And he's like, yeah, no problem. And obviously it wasn't an issue. But after that, because that first experience didn't go well, like doing an endo, and not having access to people to be like, can you come be with me when I do my next one, or be around when I do it in case I get stuck. I was like months before I even like attempted another like molar endo, right? So it took time to like, I did like some single canals, some like premolars and stuff to kind of get going again, and then kind of jump back in. So that's like that situation where like if I had like an older dentist in the office, I'd be like, yeah, I'll do another one tomorrow, and then we'll see how it goes.
No, so that's a great question. And the reason I ask is I think it's good for an example. That's an awesome story, by the way. And one, props to you for doing that and giving that patient the option, because a lot of people would just sit them back up and say, it'll be okay, or we'll figure it out if something goes wrong, whatever. So yeah, I think giving options is a good thing. I had a similar thing with that with fourth canal, where I couldn't find the fourth canal. And of course, then he ended up not even be able to find the fourth canal. But but regardless. So the first thing I would say is, have you developed a relationship with your specialist? So, and that's somewhat rhetorical, but have our new graduates, are they going out and meeting the specialists in their area? Because I'm a believer that regardless of whether you want to do implants, you want to do oral surgery, or you want to do endo or braces or whatever, that you should know your specialists and get to know them and tell them, hey, I'd like to be able to do some of this. I'd like your help, that sort of thing. Because then one is, they're going to be willing to bail you out and help you. Okay. Yeah. And my kind of thing is with this is, at the end of the day, if I kind of fall in the light of like one time bail them out. Okay. Maybe two times. Then like if it becomes, then maybe like you don't need to be doing endo, or you don't need to do molars or whatever it is. But the end, like I've done that with patients. And I think you did the right thing, because look, at the end of the day, that endodontist got paid, right? Yeah. So you just accessed it for them, and you make them look like the hero when they do it right. Yeah. And you refer to them, and you did the right thing. And so that should earn a lot of points in their place too. And so then the follow-up would be that is, did you follow up with that endodontist, and did he give you tips and pointers on what he did differently, or how you could do that differently or manage it? Because I think that's where, regardless of whether you're in an office with an older dentist who's helping you or not mentoring you, because it really shouldn't matter if you've got, because ultimately if it's got to go to the specialist, then it's got to go to the specialist. Now, surgery becomes a little trickier, just because like if you break a root tip off and you can't get a root tip, that kind of sucks. Yeah. You got to like drive them to the oral surgeon office. And that's I see where that one's hard. Yeah. But then ultimately it goes back to education. And so, have you gone to a course where you got to take out impacted third molars? Have you, or is the only one you did in dental school? Because you're right. If you don't have a senior dentist in your practice who's willing to help you with oral surgery, who's experienced, maybe you don't have any business taking out third molars at that point until you've had more education. That makes sense. Like, I think it's a huge advantage if you have a mentor that's willing to help you in the office. Still, I think you need to have that foundation of education. And what I think this is actually a problem with our generation, and I'm a culprit of it too, is for some reason we love specialty work. Yeah. Like we want to do specialty dentistry, right? I mean, we want to do all these different things. We don't want to do just bread and butter dentistry. The problem is I feel like we want to do that before we've actually gone and gotten more education, done that. You know what I'm saying? I mean, does that make sense? Yeah. And I think that resonates, because I think what you said earlier is like you and Payman have done like more CE than most people, and I think like one of the problems is, and like one of the reasons, like, and I gave you, like, I appreciate what you did as well on Instagram, is like, you're willing to post a case that doesn't go well, right? Like you post failures and talk about failures and how you learn. Yeah. Because, a lot of new guys, like myself included, like we go on Instagram and we're seeing like around the world, people just doing like crazy dentistry. And we're like everyone's doing it. Everyone's killing it. Like, why can't we do it? But you don't see the work that goes behind the scenes, like the hours of like treatment planning, the hours of like CE courses and everything like that. So you think it comes easy for everyone. And you're like, oh, this new guy's like doing like all on fours. Like, why can't I just do all on fours? And I think that's where like a lot of people get in trouble. Well, and if you look like, I mean, like, and that's why I know you're going to have him on later or whatnot, talking, but Payman's story is so unique too and cool. Just because, it's easy for people to say, oh, well, you had your dad to go in with and that sort of thing. But it's like, okay, well, that's fine. That's definitely true. But like, if we don't go out and I don't take the education and I don't go and learn how to do this and then put the time and effort to do it and like focus and go, I mean, then, and the money to spend, then it just doesn't happen. You know, he wasn't, I mean, like you kind of go back to that thing. The day I did my first sinus lift, my dad's never even seen a sinus.
Yeah.
You know? So I remember going into the operatory. He was like, I can't bail you out. And I was like, no, you know, like that's a real moment where you're like, crap. You know, and, but like, you know, Payman went straight into corporate, you know,
his story's nuts. I honestly don't know how he did it. Like that. I'll have to,
and that's the problem is ultimately like, it's so easy to say, it's just a different person to do it. But the difference is he took every opportunity for education, and he spent money and he invested in himself. And that, like, dude, is like the biggest thing is no other profession do we have the opportunity to basically bet everything on ourselves, which is like going all in on red or black.
Yeah.
And we get to be we decide how that goes. Like, to me, that's so unique. And so when I was, you know, doing that or taking out money to do this or whatever, when you're dropping $8,000 on an implant course, when you don't have $8,000 in the bank and you got to pay your note next month, you know, it's knowing, you know what, at the end of the day, I have the opportunity to go out and produce and do this. I'm going to bet on myself.
That's huge.
Make it happen.
That's huge. And so what advice do you have? So let's like, I like practical, like actionable tips here. So you're a new grad. So if you can go back to like 2015 when you finished up school, obviously like you're in a good situation, but obviously you've made the most of it by all you know, imaginable ways. If someone's listening right now and they're, you know, graduating pretty soon and getting ready to go and they have certain interests, but they're not sure sort of where to focus their attention, where to focus their funds into like CE and stuff. What have you found to have like the highest like ROI so far, like in the types of courses that you've taken?
That's a awesome question. Okay. So here's kind of where, first of all, I think I would definitely try to encourage them to get a handle on the basics and experience other materials.
Yeah.
Because that was a huge thing for me is when I graduated is like, you take this a composite restoration, for example, is like, I only thought that aesthetic X was like the only,
whatever you have in school is like all there is.
Was the only bonding agent at that point. So the first thing is like trying to take all that in. And honestly, there's a ton of continuing education. There's a ton of these meetings, these conferences and dental shows where new graduates basically get in for free.
Yeah.
So taking advantage of those is huge because the more experience and the more connections you can meet with different manufacturers. I mean, I didn't know what the difference between a manufacturer rep was and a distributor rep. Like, you know, like I didn't know you had to buy things from like a Henry Schein or a Patterson Dental. I didn't realize you couldn't just buy from like Ivoclar.
Yeah.
So I think part of it, you got to like learn that thing. Now, to actually answer your question, you know, as far as the continuing education where I spent a lot of money to add kind of things in my back pocket of procedures and techniques. What I've done is ortho through 6 Month Smiles, the pinhole graft through soft tissue with Chow. I did implants at Alabama Implant Education. I did advanced bone grafting with Picos down in Tampa. It's like the Godfather down there. And I did, what else have I done that was big? I did Botox and Juvederm.
Nice, yeah.
I did obstructive sleep apnea. Gosh, I'm sure I'll think of something else.
That's a lot in a couple of years. That's great. So so my question, I guess, would narrow down to like of all these that you've done right now, what's been the most profitable? Yeah.
100%. Okay. So let me go in the worst order. Okay. Botox has been the complete bust. I'm pretty sure the only thing I've done Botox on is my wife.
Yeah.
Maybe, you know,
we'll cut that out. I don't think she'll be listening.
Yes. I've done more Botox than my wife than anybody.
Yeah.
But maybe that's just where, shoot, I'm in a very high affluent populated area.
Yeah.
I think maybe if I was female, I would have a little better opportunity with that just because I could relate better to the patients and I could say you have wrinkles. As a dude, I can't say that.
Yeah.
And then two, what I found is a lot of the people that would do it or need it, they've already got their person. So they're not They're kind of like, why would my dentist do it? So that has been a total bust. And that was like a $2,000 course that has not worked well for me. It doesn't mean it won't work well for everybody, but it hasn't been a good one for me.
Yeah.
Okay, then I would probably put braces and the pinhole graft kind of in a similar deal.
Yeah.
Ortho, I just don't love. It was very profitable early on. A lot of patients want to do it, and it can turn an ROI really quickly. That course, I think, as a new graduate, only cost me like $500.
Nice.
And so your first case pays for your course and your materials.
So did you after I did the Invisalign course, and after I did that, I don't know if it's just maybe I'm not as confident clinically. I was like, I don't feel like after a 1.5 a day Invisalign course, I don't feel confident walking in on Monday and be like, all right, let's do this. I'll send a clin check and just approve it. Because I'm so worried about the dire consequences of if the treatment doesn't go right, even though it's pretty much idiot proof at this point. They've done it pretty well. So and you said your dad didn't do ortho, so that's one of those things that maybe he couldn't mentor you on, right?
There was none. There was no mentoring there.
Yeah.
So what was about 6 Month Smiles was, and it's actually funny. I don't know if Invisalign has this or not. Sorry, we didn't speak on it. The 6 Month Smiles has a big message board when you take the. So it's a 2-day course, which was nice, and it was a pretty extensive actually. It is wires and stuff, so it's actually some good ortho foundation.
Yeah.
That you can do. And then they have an online messaging with a bunch of their doctors.
Yeah.
So my first 12 cases, I literally just took all the pictures they told me to take. I posted them on there, and each month I would take the pictures and they would tell me what to do.
Yeah.
So literally it was kind of like a joke. I was like the assistant where I would post the pictures on there, and then they would say, because look, the reality is you have a way smarter listener. You're way smarter than I am. I just try to utilize and maximize all the smart people around me.
Yeah.
So if I can post a case on there and they can tell me exactly what to do, where to put the bracket, how to bend the wire, what to use here, and then at month 1 they tell me the same thing. Month 2, next thing you know, they're moving and doing it. So that was a huge help. So literally they would walk me through, and then if I get to a point where this isn't moving, what should I do? They'd be like, well, try this.
Yeah.
So that was helpful. The negative to and so I'm sure Invisalign community may have that too, but then I would tell you, well, why don't you just start with a lower anterior case where it's
just
one tooth out of line. That's, you can do that. It's
yeah.
easy. But the negative to any ortho is it takes a long time.
Mm-hmm.
So even if they paid me all up front, they may pay me $3,000 or whatever, or $3,500, whatever you're paying. Then I got to see them 12 more times.
Yeah.
That kind of sucks because I was like, even though it's a lot of my assistant's time, it's still a chair and so it's still time. So early on, what was I had tons of time. I wasn't busy. Ortho was really good for me because it helped me get more profitable. It helped me make more money to afford more CE.
Mm-hmm.
It's all about getting off the ground.
Yeah.
Now I'm doing less and less ortho. 1, because I don't love it. 2, because it takes a lot of time.
Yeah.
I guess really I just don't love it. It's profitable.
You gotta like what you do.
Everything's not for everybody.
Yeah.
And I've been doing all the 3D printing and aligners and trying to figure that out. I'd like to move more to aligners just because, it will. It's less chair time. Now, all that's to say, I'm going to level 2 in London in May.
Yeah.
Level 2 Smiles course because I want to write off to go to London and Paris.
Yeah.
And I'm also sending all my assistants to Atlanta to the team training for 6 Month Smiles. So my gut is when I come back from that, I'll probably ramp back up just because the assistants will be motivated. And I think that may be where I've dropped the ball too, is I didn't train my team well enough to just be able to handle it. So that's the ortho side. Now, pinhole. Okay. Pinhole was kind of very similar. I came out of the gate and I was like, let's pinhole everybody. Everybody needs pinhole. And the first couple ones went really well. And then I had 1 or 2, talk about needing to change your pants. And I had one lady come back and that's the thing. This is not all guns and it's not all roses and, This lady came back in and I did it on her full arch lower.
Yeah.
And, the problem was I was young and dumb. I didn't, she didn't have a lot of attached tissue to begin with.
Mm-hmm.
I probably couldn't hold you necessarily a lot. I just didn't know as much as I knew now. Like I'm learning, right, every day.
Yeah.
So she comes in and it just didn't respond well. I think I had a couple tears in the surgery. Like my pinholes got too big, which is basically just an access point is what they call it. Like an incision. And it kind of tore up to the top of the papilla. And then it just kind of like the body started like attacking itself and like eating away tissue. Yeah. So it was not good. And so I was meeting her every single day after hours to biostim her with the laser. Like to be at the office, I was going to be at the office.
So you didn't, at that point, you didn't still like refer out? Like you were like, I can handle this? Like,
well, so that's a great question. Dude, I was like,
it's brave, man. Like, I'm just like, I'm in awe right now. I'm like, man, I would have like shot my pants and like, yeah, straight off. Like, and
then again, like my dad doesn't know what to do. He can't bail me out. There's no, like, I am like literally getting sued. Like they are suing to serve. Like, then I'm like, did I even get consent form signed? Like, what are my notes good? I'm like panicking, right? Like everybody knows. And I'm being honest with her. I had a conference call with Dr. Chow trying to figure out like what happened, what went wrong. And so, kind of nursed her back, got back, basically we ended up we didn't really get any worse necessarily, but we definitely didn't get any better. Yeah. Gave her money back, obviously, and we kind of survived. At that point, I became a lot more timid. What it also did too, was it made me kind of, try to appreciate what was happening more and really know what I really try to make sure that I had a full understanding of cases it was good for, it wasn't good for, that it was not an end all be all. So I've still had a lot of really good success with pinhole. I'm just way, way pickier with my cases. Again, it comes from that standpoint of like when you're young and you're not busy, I'd pinhole anything, right? Yeah. I realized like, okay, it's not great for these cases. These cases would be better off. And so that's what I've done. So now I did one a couple weeks ago that, man, it's full upper arch, phenomenal results. It looks great. And the nice thing about pinhole, which I love about pinhole versus the ortho, is like I charge $3,000 for an arch. People charge more. I'm sure people charge less. But that takes an hour and a half and bam, I'm paid. Yeah. There's no follow-up, no procedures, no nothing. And so from a efficiency standpoint, ROI standpoint, that's been pretty good.
That's pretty good. Yeah.
We've probably billed over $200,000, in the year or 2 years, whatever it's been since I took them. So if you look at what they cost versus the relative to that, they've been successful.
Good.
Yeah. I would just say, pinhole kind of comes in waves. Same with ortho. Those two kind of fall in that line. Okay. So now it's really good ones.
Yeah.
So the biggest one for me, and part of it because I enjoy it, was implants.
Yeah.
So my implant course cost $6,000. My kit came with implants cost like $4,000.
So what's the so before you kind of go on, I just cut you off there. Sorry. What's the requirements for, like, I know here in Canada, like with our like dental college, it's got pretty strict. Before it was like it's pretty lax, and it's pretty lax in Australia in terms of like when and like can you start placing it, like in terms of like how much CE you need. So right now here in Canada, like in Ontario or like our province, you need 70 hours of CE for placing and 70 hours of CE for restoring before you can even actually like do it.
Wow. It's actually a great policy, I think, honestly.
Yeah. So is it over there? You can just kind of do it right out of school, or is there some sort of requirements you got to fill?
Just do it out of school. I think it's pretty cowboy in America. Yeah. Definitely a cowboy.
Yeah.
No, I think maybe you have. That's a great question. I think that's the problem, is there's not really any regulation, because the problem is even look at dental schools. Some dental schools in America, you get to place implants. Yeah. Others, you don't even get to restore them. So we definitely have a kind of a wide variety of things there. I think my malpractice insurance wanted me to have some I think I sent them my certificate, and they wanted to like see that I at least placed an implant.
Yeah.
But my course was 6 days. 3 weekends. 3 days was all didactic, and the second 3 days was all surgery. 3 days.
Like cadaver or like live patient?
Live patient.
Oh, nice.
So I put 12 implants, live surgery at my course. So that was really, really helpful. Mm-hmm. So I came back from that, and actually it was funny. I came back from the first weekend and placed an implant. It was like a month between the weekends, and placed an implant between those 2 weekends. Because I was like, well, I got it. It was like an easy one. I was like, I can do this.
Yeah.
But that by far has been the most rewarding ROI and the most fun ROI. I also love surgery, but I mean, last year I placed over 100 implants.
Nice.
So, we charge $1,500 an implant. So that's, 150,000, I think, right there.
Yeah.
And then you think about all the implant restorations that go on that, the abutments, all that stuff, that adds up really quickly. The amount of bone grafts and other things that kind of go with the implant. So just that whole workflow has been huge. I'll kind of piggyback that on like what's been the most ROI for a practice or equipment that you could buy. Gosh, man, cone beam. I wouldn't practice without a cone beam.
Yeah.
Just because the amount of dentistry we diagnosed and the amount of implants that's allowed us to place is, insane. And so,
you have a 3D printer too, is that right? The practice now.
Yeah.
So do you do your surgeries like freehand, or are you always like you all about guides and stuff?
I do 60% freehand, 40% guided.
Okay, nice.
And I'll tell you a piece of technology that is definitely more. I mean, it has some good ROI with surgical guides, and I think it's fun and it's exciting. And it's not that expensive, but as far as like something that doesn't necessarily, I think, have the ROI or excuse me, maybe just doesn't work in the busy workflow like everybody wants to think it is 3D printing.
Yeah.
Look, it's here, it's coming, it's going to be better. But everything you see on Facebook and Instagram, I think, is way more glorified in the 3D realm.
So that's the next thing I want to ask you. Like, obviously I know you're pretty big into like technology and all that stuff. So like, I know you guys have a CEREC and you're pretty heavily using that. So what's like and you said the CBCT, like what's the main, like, so, I mean, obviously like most of my listeners aren't like practice owners at this point, but if they're thinking about it, like adding technology to their practice or speaking to their, their boss about getting some stuff in the office, like what's the main thing that you would say you would recommend, like technology wise, to add to the practice to kind of help them out?
So I'm very passionate about this part. So cone beam 100% is the number one thing I think that people should buy.
Yeah.
Okay. For a couple of reasons. One is if your practice is trying to grow, cone beam produces more dentistry because you find more dentistry to do. You see more root canals. You see more bone grafts. It opens up sleep apnea. You do more implants. It just multiplies everything.
So do you do it? So when you have a new patient in the office, what's your protocol now? Do you just do a CBCT instead of a pan?
Bingo. Every new patient in our office gets a cone beam and 4 bite wings.
Yeah.
Every time, all day. What if they don't pay for it? I don't give a crap. I'll give it away.
Yeah.
We put a pan for it because it generates a pan.
Yeah.
But every single day, because I will diagnose, because to me it's a loss leader, right? Like I'm trying. I mean, I view hygiene completely as a loss leader. I mean, some people are all about making this big profit center, and it is profitable. But to me, it's all about what can that thing and what can that area diagnose dentistry for what really produces, which is me.
Yeah.
Or the other doctors. The biggest thing that I don't understand and why there's such a daggum fetish right now in our industry is everybody wants scanners. And like, what the heck is the ROI on a scanner?
Yeah.
I mean, seriously, I'd ask you the question, what's the biggest ROI?
Nothing. I think it just like makes your life easier sometimes, or like it's just like a cool tool cool toy to have in the office. But
it cracks me up because I don't think people actually think about that. Because if you think about it, dentists are some of the most cheap people I know. I mean, I get on Facebook like, where can I get the cheapest cotton rolls? I mean, it's literally where can I get the cheapest lab crown?
Yeah.
Yet those dentists are willing to go out and buy a $20,000 scanner or $30,000 scanner. And it has like zero ROI. Now the listener right now is probably like, well, dude, it saves money on impression material. It's like, you know how many impressions you got to take before you save 20 grand? Like a lot, or they give me a discounted lab bill. It's like, well, yeah, I'm sure they do because they realize the writing is on the wall. And so if there's an area I'm very anti-passionate about, it's like, I don't understand the whole scanner thing.
Infatuation. Yeah.
I don't, and I don't want to be system loyal. I mean, obviously, I can sit here and tell you why I think CEREC is awesome and that sort of thing. But ultimately, as a business owner, it has to make financial sense, and I just don't think that a lot of those things do. So, if there was one if I got $300,000 to open up a practice and do a startup, because what's the first thing you need when you open up the door? You need patience. You know how hard it is to get new patients. Well, what if you can make each one of those new patients more valuable because you have a that could diagnose more dentistry.
Yeah.
You know, that
That's
was what
huge.
really happened in our practice. Okay, let's take our practice. So we basically doubled our practice in 3 years with only adding 100 more patients, active patients. So basically what happened was we doubled the amount of procedures we were doing on those patients because of COVID.
Yeah. And you added ortho and you added pinhole and implants, and that's huge.
Bingo.
Yeah.
So the big thing is, you know, people spend all this money. I mean, that's another thing. Gosh, I get on. I apologize, but let's think about this. People talk about comb beam being too expensive.
Yeah.
$2,000. Okay, let's say $2,000 a month. Yeah, they'll go spend $3,000 a month on a marketing campaign that they don't even know if it's making them any money.
Yeah, they don't track it. It's just like, yeah,
they don't even know how to track it. So, you know, they're spending $1,500 a month on Yelp.
Yeah.
But I digress.
Yeah. That's awesome, man. We went through a lot of good stuff there, so that's awesome.
Well, let me talk about the final one for a second here.
Yeah.
I gotta ask you. See, no problem. The final one, sleep apnea.
Yeah.
So,
yeah, I know you're big into that.
To me, if I'm a young dentist graduating dental school, I'm a dentist in an associateship that doesn't own, and I'm struggling to find work, I would be seriously looking heavily into getting into obstructive sleep apnea. One, we are only going to be hearing more about it. It's going to be more in the news, more just like patients now know about implants, they're going to be knowing about sleep apnea. And they're going to need someone to treat it and do something about it. And so they're going to be looking for people. And so, I mean, we did over $200,000 in sleep apnea last year.
That's huge.
We'll do almost $400,000 in sleep apnea this year.
Mm-hmm.
So those are real numbers, and you're changing lives with that stuff. So I'm not even going to go down that rabbit hole.
Yeah, that's a whole nother episode in itself. But
that's a whole other episode in itself. But the beauty of apnea is not only is it a very profitable thing and it's amazing for your patients, but it's all team driven. So you talk about a good ROI. I'm not even in the room when that's happening.
Yeah.
So, you know, the implant, I have to actually be there and place it versus like sleep apnea. I just walk in and say, hey. So anywho.
Yeah, that's awesome. All right. So the last thing I want to quickly just talk about before we wrap up here is obviously like you've done all the CE, you got all this, skills and procedures under your belt. And obviously you're an outgoing guy, you're a podcast host yourself. So you're comfortable communicating with patients, right? What's like your main things that you've picked up, in your, few years of working now in terms of case presentation, case acceptance, and like what, a couple quick tips would you have for someone listening who has like taken an implant course and, they're struggling to get case acceptance into like placing implants, for example?
The first thing I would say is everyone has to be themselves. Okay. Yeah. What works isn't going to work for you. It's just going to work for someone else. Like in my practice, I'm beyond laid back, super personal, super open. It just works for me. Some people, I had a man bun 3 weeks ago, right?
Yeah.
It's going to be shirt and tie, classy, no jokes, very whatever, and that's going to work for them. I think first off, find what works for you and don't try to be someone else.
Yeah.
Second of all, I would say learn that not every patient wants to know as much detail. They want to know like the main points, how to get it, what's the problem, how to fix it, what's it going to cost, and how soon. We're all pretty much, for the most part, engineer mindsets, just by nature. And such a small population of our practices are like that. So I think, and I see it myself, I talk myself out of treatment sometimes more than I talk people into treatment. So, if a patient's missing a tooth, well, Mrs. Jones, you're missing a tooth. We'd like to, replace this with a tooth replacement. We call it a dental implant. It's going to be, 3 steps. It's going to cost this, be confident about it. I don't mind discussing fees with my patients. Like I want to know, like, look, this is what it is. This is what it costs. And I'm okay with that. Part of that is because I feel like I can close it better than someone else. So I don't want to be all about it and then get to the front and Ms. Jones, well, it's $3 and then they freak out, So, I think that being, faking this confidence of I can handle it. I know what I'm doing. This is what it is important. And then I think those are pretty good ones.
It's pretty good ones. Yeah. So, how do you gauge how much detail someone's like after? Like when you get into the room, like how do you gauge the room? And like this person just wants me to tell them exactly what needs to be done and that's it? Or no, they want me to like go through options and pros and cons kind of?
Someone was telling me last week, and they're like, the first, if you kind of break up the consultation or whatever, really they said you should spend 8 minutes on a consult. 4 minutes, you should talk nothing about dentistry. And I kind of agree with that because in that 4 minutes, you're going to find out very quickly what, because if they're some people they're only going to buy dentistry from you if they like you.
Yeah.
So, right. So you figure out, you need to build this rapport. If they start communicating with you and talking and it's fun and it's going, that 4 minutes may turn into 7 minutes and only 1 minute about dentistry. Well, you only may need 1 minute at that point to sell the dentistry versus some people, they may give you 1-word answers, 2-word answers, and you kind of know, okay, this person may be a little more of like, just get to the point.
Yeah.
I think one area where my style actually, I think works is I will tell patients up front very quickly, if I'm giving you too much information or if I'm not getting to the point quick enough, tell me,
I love the whole honesty thing, man. You kill it with that.
That's probably like my mantra.
Yeah.
Because look, a lady came to me today for 4 veneers. Yesterday, she went to somebody who's like the person to go do veneers in like the Southeast.
Yeah.
Like lab wise, way more. But the patient just responded better to my down to earthness and my honesty and transparency. Some people will respond better to, they want to be wowed, and they want an experience. And so that's my big takeaway is be yourself, find something that works and don't try to be someone else. And then with that being said is, if you struggle with case acceptance, don't be afraid to ask for help. Don't be afraid to record, set up a camera in an operatory where you can kind of record it for yourself, or even if it's just audio in your pocket.
Yeah. That's a good tip.
I used to do that when I was first getting out because I would be like, oh my gosh, that's where I lost them. And you'll, dude, how many days some days you walk out of the operatory and you're like, bam.
Yeah. I was on form. Like everything's flowing. Like, yeah.
Like you could have sold them $100,000 car and they would have said yeah. Then I'm like, no chance they're scheduling. I didn't believe in it. They didn't believe in it.
Yeah.
Like it's just, and so I think trying to focus on those days where you do it really well, figure out what you're doing well. And that's where I think recording yourself is a really, like, just carrying an audio recorder around and record those conversations goes a long way.
That's huge, man. I think that's awesome. And I think one of the biggest things that I'm learning now is like you said, one is like, you got to take the courses so you have the skills and you have the confidence. Like if I'm talking to about an implant to a patient and I know I'm like referring it out because I'm not placing it myself, like I'm not selling it. You know what I mean? I'm just kind of like, oh, you can use an implant here. It'd be kind of cool. Like if you want, I can arrange a referral kind of thing. But I think if you do a procedure and like you like love doing it and you're trained enough to do it, like you can sell that all day long. And I think people will see that confidence, or the team will see the confidence. It'll just like permeate throughout the whole office, and then you're kind of off and running, which is pretty sweet.
I mean, like that was a struggle with like sleep apnea when we first started. Was like until the team started seeing the impact it had on patients and the follow up and the stories, that's when things got on fire.
Yeah.
So I think part of it is like, and obviously this is hard for associates when you don't have control and that sort of thing. But I think you can still have conversations with your hygienist, like making sure that they're educated on the procedures you're wanting to do, that they understand the benefits of it. Because like you said, if you don't value it and they don't value it, then it's just this casual, well, you could do this. Well, who wants to do something? Who's going to come in your office and spend $6,000 on something that like they like it's, well, you could. No one wants your office really and spend money.
Yeah.
You got to create the value of why they need to do it.
Mm-hmm. Absolutely. That's awesome, man. Thanks a lot. We covered a lot of good topics. I think people will get a lot of good value from this episode.
It's fun.
Yeah, we'll do it again for sure. And so if you want to just plug your podcast, obviously you got a much bigger listener base than I do. But I mean, some of the guys that I have listening may have not heard about the Millennial Dentist Podcast. I'm a big fan. I listen to all the episodes. So if you want to maybe just close up with a little tidbit, the elevator pitch about the Millennial Podcast, and then we'll wrap it up.
My boy Paymon and then Daniel Holsinger, we started this podcast about a year and a half ago. It's the Millennial Dentist Podcast. You can check it out, millennialdentist.com. We're on Instagram, Facebook, Twitter, all that stuff. Basically, we have a good time. And we do this. So we're just trying to keep up with this guy over here. You know, we talk about dentistry, solve all the world's problems, but it is what it is. I think the beauty, and I say this all the time, man, what a freaking fun time to be a dentist.
The best, man. Absolutely the best.
It doesn't get any better. So if you're listening to this and, you know, you're down in the dumps of dental school, or, you know, you're having some older dentist kick you, and it's just hang in there, and keep pushing and keep running, because, man, it's fun, and I'm having a blast.
Awesome stuff, man. Sully, thanks a lot for coming on. We'll hopefully do it again sometime very soon.
Definitely doing it again. And you're coming on ours soon.
Yeah,
so
for sure. That'd be great.